findings and a gene.
And what is your illness?
I have Ehlers-Danlos syndrome, which causes several other things to go awry in my body.
Would you expand on the effects of?
So for instance, it causes fibromyalgia, which is a nerve disorder, and that causes just pain in a lot of places that there shouldn't be pain. With EDS, a lot of other patients have very different symptoms. There's no cookie cutter way, which is why it's so hard to diagnose. It took them 12 years to find a diagnosis for me because none of my symptoms matched. It was all random. So my EDS manifests mostly in my rib dislocations and my intestinal problems, like my IBS and just problems with nausea and things like that. So most of it's just rib pain.
How has it impacted your everyday life?
I think that oftentimes people see me and they think I look normal. They think, well, I hope I look normal, but they think I'm happy and bubbly and I think that it's less affected my work and more affected how people view me once they find out, if that makes any sense.
Yeah.
I guess it just affects how I'm perceived versus what's really going on. I'm perceived as one thing when I'm really another.
How were you perceived, like before you found out you had this, versus how people perceive you now? Can you talk a little bit about that?
When people find out, so when people first meet me, they're like, oh, she's young, she's kind of vibrant, she's smiley, she's happy, which all of those things are true. I am young, I am vibrant, I am a happy person. But when people find out that I live with chronic pain and just deal with health problems that not many people my age do, I've noticed that their attitude towards me changes. It's one of two things. Either they don't believe me, or they pity me and are scared of me. They're scared of me because they think I'm weak, when in reality that's not the case.
Yeah.
I'm a lot stronger than a lot of people.
Yeah. What are you hoping for you to take away from this experience with these models in this shoot?
Well, when I came up with the shoot, I just wanted to give other women like me an image that they can see and be like, see, I'm not the only one.
Yeah. What are you hoping that the other people take away from this?
Same thing, like, hey, be nice to everyone because you don't know what they're feeling.
Yeah.
Sorry.
If you could, the people that will watch this, if you could just give them really one message of everything, what would it be?
To offer understanding and not pity. To listen and not preach. And I think the majority is to be kind, even when your own personal experiences, maybe with people who were faking something, or people who were just using something as I don't want to say an excuse, because people might see what I have and think I'm saying it's an excuse for something, and that's not the case. But I'm saying their own personal experiences to affect how they see someone. So I am different, and we're all different, and I want them to understand, like, hey, I want to take the time to be kind and understanding, and I don't want to treat them like they're breakable, because they're not. They're resilient. I just want other people to put themselves in our shoes and think about what they would feel, to offer empathy and not sympathy.
That's good. What do you think your reaction to the reveal will be?
Well, considering how emotional I get just talking about it, I'm assuming I'm going to get very emotional. I've never physically seen my pain, and no one else has ever been able to see my pain. It's like, I remember I had to have surgery for something to get my gallbladder removed, and they said I wasn't going to have scars, and I was kind of mad because I was like, no, it hurt. Like, I be able to see that something hurts, but you can't see it, and I can't see it. I can only feel it.
And that's part of where your vision came from for this shoot, right?
Yeah. When I came up with the vision for the shoot, I got kind of frustrated because I was constantly telling people I'm in pain and I couldn't show them. I couldn't show them where. I can't even point to some of my spots where I hurt because it's on my back or it's on my leg or wherever. It's just I can't even point to it, and I can't describe it. And so I wanted to physically be able to see how I feel, to physically be able to offer the same thing to someone else. And so when I contacted these models who all have different things, I wanted them to be able to do the same, to offer, or not to offer, to see their physical pain, because it is physical, it's just internal, not external. So they're taking the internal pain and we're painting the outside.
Yeah. You've got some paint going on right now. Can you tell us what the colors mean?
So gold is the one color that we decided to let it mean different things to the models. For me personally, it either means pressure or white noise pain, so pain that I've had for so long I don't even notice. So that's what you can tell with my fingers, is because they hurt, but I don't really always notice them. And then the red represents burning pain, so that if you've ever had a pulled muscle or pulled muscle or a torn muscle, that burning sensation that just like feels like something's ripping inside of you, that's what the red stands for. Blue stands for aching or stiffness. My neck gets really stiff and it aches a lot. And then purple stands for stabbing. So if you see right here, I have a big purple mark, and this is where my ribs dislocate the most. They dislocate and it causes a stabbing sensation right here and right in my back, because they put pressure on my lungs. And so what actually causes that is my muscles get so tight that they rip them out of place.
Yeah.
So that's kind of where the blue comes into play. You see it all kind of mixes together because one thing causes another. It's a ripple effect. And then another one of the models, she has orange, which stands for pins and needles.
And you and Jamie Lee both share the same disease, but your paint looks very different.
Yeah, it's actually interesting because we both have we both have EDS, but our EDS has caused not only different secondary illnesses, but it's caused different symptoms in general. So she's got polyneuropathy, I have fibromyalgia. She has problems with her hips, I have problems with my ribs. We both have stomach problems, so that's something we have in common.
Yeah.
But our paint is completely different. And that's why when I came up with this concept at first, I wasn't really accepting of the idea of two people having the same thing. And then when I was talking to her, I was like, yeah, we have the same diagnosis, but our things are not the same.
What are you hoping, if you could give a message to maybe someone in your situation a couple years ago who is maybe experiencing pain but doesn't really know what's wrong and nobody seems to believe them, kind of how the same boat you were in, what would you tell them?
Considering that it took them 12 years to give me a diagnosis, I think I would tell them to not be patient, to just fight for themselves, to be an advocate for themselves, to be like, hey, no, I know it's real, to do the job that no one else will, because only you can tell how you feel. No one else can see it, no one else can feel it. It's only you. So I think that, and to always believe themselves. Oftentimes we are told that our pain is in our head. Go see a psychologist. You know, you're too young for that. You're not too young for anything. I was born with this. Like, this is just as much a part of me as my hand or my foot. That's how long it's been with me. And it took me so long to make people believe me. So I'm bed rest for 2 years. And the day I got my diagnosis is the day I started getting better. So just keep fighting, because you will fight every single day of your life. But once you get the diagnosis, the fighting will be easy.